Only on Sunrise this morning, NBC5 News is continuing our partnership with Asante to bring you better health. This morning, we're learning more about strokes.
It's time for Better Health, and I'm here with health expert Beth Coker with Asante. Thanks for coming in.
Good morning.
And this morning we have Jessie Hibner. So you are a family nurse practitioner. Thank you for coming in.
Thank you.
Today we are talking about stroke awareness.
And Jessie, we know that in the United States there are 800,000 strokes a year, and stroke is a leading cause of death. And one of the most debilitating long-term effects of stroke can happen to a patient. What are the signs and symptoms for a stroke?
That's a great question, Beth. Really, when you're talking about stroke, any kind of change in your ability to communicate or function is something that you want to be aware of. There is a mnemonic, be fast, because with stroke you want to be fast, right? So that kind of helps people recognize some of the more common symptoms. So the B stands for balance. So any difficulty walking or maintaining your balance, that's something you want to think about. Eyes, changes in vision. The F stands for your face. If you start having a facial droop, numbness, tingling, can't feel the side of your face, that's something you want to be concerned about. A is for arms, holding arms out in front. You should be able to keep both your arms up at the same time. S is for speech, and a lot of times people think that's always just slurred speech, but really it's slurred speech or having difficulty finding the words that you want to say or saying things that just don't make sense. And then the T is for time.
So how does Asante assess and treat a stroke victim?
So we do have different levels of stroke care that we provide through our Asante Healthcare. Rogue is a primary stroke center. So at Rogue, we're able to completely care from the patient from the moment they roll through the door, and then hopefully provide interventions to them if they get to us soon enough, right? And then we assess them and treat them at the facility.
So data shows that if patients are treated at a primary certified stroke center, their outcomes are better. How is that treatment different than just going to a hospital that isn't certified?
So we do a lot of training with our staff. Our doctors, our nurses, everybody who comes in contact with a stroke patient has had a lot of training and education to be able to provide the most up-to-date care that we can.
And is this comprehensive care available 24/7?
So Rogue is actually in a great transition time. There's so many things changing in the stroke community, and we are able to offer 24/7 care to our patients. And realistically, the thrombectomies are there as well. So we can get in there, we can give you medication to break down the clot, or we can go in there and take that clot out. So really exciting times.
Are we educating the community members on how to recognize stroke?
So we're out there as much as we can, and definitely that's going to be more to come on that. So some classes coming from us.
Great. So know the signs, and time is critical.
Yes.
Thank you both so much for being here. We'll be right back.